Hi, I'm Ron Lieberman, emergency room physician at Glendale Adventist Medical Center, and I'm here to give you a health tip. The health tip that I would like to impart on you would be the idea of being preventative and being able to take care of yourself before you get to the ER, so hopefully you don't have to come in. Check your cholesterol on a yearly basis. Good exercise, good diet, a low stress-free life would be wonderful. At Glendale Adventist Medical Center, we're here for you to be able to help you in any way we can. Please remember that you have to have a bit of patience. There's a lot of people who are sick, and we're trying to help everyone. But each and every person who comes, we're trying to give them individual attention. So please, each time we ask you to give us your story and what happened to you, try to be as thorough and concise as you can. That'll help us help you.
I've been golfing for years. Golf is not just recreation for me. It's part of doing business. Lately, my swing keeps slowing me down, and the pain in my hip is making me feel old. So I went to see an orthopedic surgeon at Glendale Adventist Medical Center. I found that I needed hip replacement surgery and was pleased that they offered a minimally invasive approach. I was back at work within a week, and my swing is better than ever. Thanks to Glendale Adventist, I'm back in the game.
Welcome back to Healthline. Tonight it's the conversation of emergency rooms. And tonight we're talking about the best emergency room in this community, Glendale Adventist Medical Center. And joining us is Dr. Ron Lieberman, emergency room doctor. Doctor, you were talking about the conversation of teamwork and committees. Bottom line is we have to be aware of our bodies.
Mm-hmm. Yep.
What do you say to patients in regards to becoming more familiar with their body? How do you teach them to do that?
I've always been a bit shocked about our educational system and how little we're taught in school, in high school, grammar school, about our bodies. You know, the fundamental thing we have that we should know the most about.
Do you think we don't talk about it enough at all?
At all, yeah. We have I know my own personal experience is physiology classes we take, but they don't talk about things that are really practical. For example, what's a heart attack? What's a stroke? What are the symptoms and signs of these things? What's a pneumonia? When should I be worried to come to a hospital? When do I need a hospital? You know, when am I overusing the hospital? All of these things together. You know, so I think if they talked about what does a heart attack mean? What is the pain? What is a pain I might be feeling? It's things that are very common.
So signs and symptoms.
Yeah, things that might kill someone. You know, that go completely, people are unaware about these things. You know, I've seen people come to the ER whose arm hasn't been working for 3 days. And I said, well, why didn't you come to the ER
Seriously,
sooner?
you see?
You would imagine.
Okay, what made you not come into the ER because you couldn't do that?
That's it. They thought, well, the answer was I thought it was going to get better.
Really, because we all know what it means to be sick.
Yeah.
However, as you were saying earlier, and we're advocates of signs and symptoms and really paying attention to what you have to look forward to.
Well, what are the signs and symptoms of stroke, and what's in a nutshell that people can remember?
Stroke is you're going to have an acute onset of weakness. It's going to happen right away. It's going to be some weakness of an extremity, of your arm or your leg. It'll be maybe some slurred speech or facial droop that comes on all of a sudden.
It's called FAST, isn't it? There's a breakdown of it, an acronym of FAST that we've talked about here. Face. The raising of the arms, speech, and time. Stroke is time loss is brain loss.
Yeah, well, that's exactly the idea. You know, we have about 3 hours, maybe 3.5 hours before we can get in and do something. And what we would typically do if somebody comes in with what we call a thrombotic stroke, it's when a blood clot flies up into the brain and stops some of the function. You can think of it like a pipe that gets blocked. Same idea as in a heart attack. The artery gets blocked. No blood flow passes, and that part will start to die. So in a stroke, we'll give a medicine called TPA, which is like Drano for the veins. That clears it up, gets rid of the hairball, you know. And we have about 3 hours to give it. And if they come in after that point, we can't do, well, there are other interventions we can do, but that's really the main one that we can get to.
And as Suzanne, we talked about too, the signs and symptoms of heart attack.
Heart attack also, you're going to have, usually there's going to be pain. Sometimes that pain will start in the chest. It can move up towards your arms, towards your jaw, towards your neck, towards your teeth. Sometimes short, yeah, the arms exactly. And you can get short of breath or nauseous or sweaty. But it might be one of these symptoms. It might be two of these symptoms. It's hard to tell. And definitely as we all get older, these symptoms change. And sometimes people come in with just nausea. And so that makes it a little bit tricky and a little bit difficult.
Now, what about people who, I've gone to the hospital with people who were swearing they had a heart attack, but it was really a panic attack.
Or an anxiety attack.
You must see stress causing all kinds of symptoms that bring people into the ER.
Well, for sure, in today's world, we're seeing a lot of stress.
Especially where we are in today's economy and lifestyles and all of it.
Yeah, people are under a lot of stress, too much, and it's hard for us to see, and it's hard for us to deal with also. But the question is, how do we deal with stress on a better level to make ourselves feel better?
What do you do to de-stress?
A lot. One big one is exercise. I think that's a key one. It really helps you be able to burn off the energy and relax and help take care of your body well. Another thing I do is going to be yoga, which is something, again, it gets into the whole meditation idea, that you can clear your mind, and it's really giving you good coping skills to be able to handle it. We all have stress, and I'll tell you, in the ER we have lots of it. But even for me, while I'm working, I'll do things. I won't do yoga in the ER, but I'll concentrate on my breathing to relax just a little bit, to be able to calm myself down. And I think that can be a universal, everyday thing we can do. It's really like going to the gym for your mind. That's the most beautiful part.
When we come back on Healthline, we are going to be talking to an emergency room patient. Her stressful lifestyle is in part what led to her illness, and you'll be amazed at her story. Stay tuned.
And look, I'm deep breathing right now. Here I am at PRN Ambulance, and joining me are President Avo Avedisian and CEO Randy Skomsvold. Gentlemen, thank you so much.
Absolutely.
Let's dive into the history of PRN.
PRN started 11 years ago. We started off as an idea, didn't have any resources, didn't have any ambulances. We do wheelchair van service as well. We had limited funds, so we bought 3 ambulances and just started off organically, and over the years just built the company to what it is today. Glendale Adventist gave us our first contract, and since then we've never looked back.
Now, Randy, talk to me then about keeping healthcare in the community.
We keep it in the community with how we deploy our resources. We work incredibly close with the administrators of the hospitals. We make sure that that they get virtually everything they need. We are on time as often as we possibly can, and it's usually well over 90%. And we keep it in the community by hiring the folks that we have. The station that you see here being in Glendale, this is where our roots are, so it stays here.
And what is PRN's mission?
Serve the community and the hospitals that we have developed relations with as best as we possibly can. We realize that we're constantly transporting someone's grandmother, grandfather, a loved one. You know, we try to keep that close to the vest, and that's our mission.
So bottom line is you pay attention to what the customer needs.
Absolutely.
Avo, Randy, it is an absolute pleasure. You know, Randy, wow, I'm feeling a little bit lightheaded.
You all right? You all right?
I think I need a little. Yeah, can we?
Let's go. Let's take a
look. Oh, wow. Okay. Oh my goodness. Randy, am I going to be okay?
No, not as long as I'm taking care of you. I think Jennifer should be taking care of you, not me.
Jennifer, am I going to make it?
Yes, you will.
Oh my goodness, thank you. Well, until then, what do you look for in regards to that information, health information of a patient?
We look for the history, the medications that they take, the type of allergies they have, and their symptoms that are going on now, and if it's been going on. And for families that are following us in their own car, I just say get there as safely as you can. Make sure they know the way that they're going, because I don't want them to follow us going faster, thinking they have to make that yellow light and possibly get in an accident on the way over there.
Okay, and also make sure we have the Medi bracelets, and any information you can give to anybody in regards to this situation will save someone's life. Goodbye, everybody.